evening, I'm Sandy Collier, and in part 4 of our Opioid Prevention Education series, I sit down with Senator Bobby Powell, who talks about the progress being made in the fight against opioid and the work that we still have to do to combat this problem. I also get to sit down with Latasha Coles. She's the first Black female and the only female to serve as Deputy Fire Chief for the City of Boynton Beach Fire Department. She'll share with us her insights. And we went to Riviera Beach Police Department, where we had a sit down with the new police chief, Nathan Osgood. But before we start our series, a message from our executive director and our board president.
Hello, my name is Laurel Dalton. I'm the Executive Director for the T. Leroy Jefferson Medical Society. I would like to thank you for participating in our education series today, along with our wonderful expert panelists, as well as the Health Council of Southeast Florida. This activity has been planned and implemented in accordance with the accreditation requirements and policies of the Accreditation Council for the Continuing Medical Education through the joint providership of Florida Area Health Education Center Network and T. Leroy Jefferson Medical Society. The Florida Area Health Education Center Network is accredited by the Accreditation Council for Continuing Medical Education to provide continuing medical education for physicians. The Florida Area Health Education Center Network designates this live activity for a maximum of 5 AMA PRA Category 1 credits, 1 credit per session. Physicians should claim only the credit commensurate with the extent of their participation in the activity. The Everglades Area Health Education Center, provider number 50-3066, approves this program for a maximum of 5 contact hours, 1 contact hour per session of continuing education credit through the Florida Board of Nursing, the Florida Board of Dentistry, the Florida Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and the Florida Council of Dietetics and Nutrition. Before we get started, I would like you to hear a little information about our medical society and our programs in the community. Most of these initiatives were made possible by grants and donations to our organization. We also have several gift cards that will be given out to attending pre-registrants by random number selection on the first live broadcast of this webinar. And at the end of the session, please scan the QR code or follow the link provided for the required assessment for your education credit. For those viewing live, the assessment will load immediately at the end of the session. Thank you again, and please enjoy this education session.
Hello, my name is Dr. Tiffany McCullough. I am a board-certified emergency medicine physician as well as a wellness physician. I am currently the board president for T. Leroy Jefferson Medical Society for the term 2020 through 2022. I'm honored to be here. T. Leroy Jefferson is made up of healthcare professionals dedicated to improving health and wellness, access to care, academic and career development, as well as being sure to create additional opportunities for the underserved community. With opioid deaths on the rise across all racial and ethnic groups, our society has elected to educate the provider community on opioid-related issues because, truthfully, a project like this aligns perfectly with our mission. This is a 5-part series, and it is made possible through a grant from the Health Council of Southeast Florida. According to the Centers for Disease Control, nearly 500,000 people, that's 500,000 people, died from overdoses involving any opioid. This includes prescription medication as well as illicit opioids. In recent years, nearly all racial and ethnic groups are affected, and everyone has really experienced a significant increase in opioid-involved related deaths. That includes synthetic opioids and manufactured opioids. With our overarching goal to save lives, we plan to educate medical providers to give them a comprehensive and holistic approach to teaching patients with acute and chronic pain. We aim to help providers. We are using a 5-pronged solution. These measures include improving their clinical decision-making, helping to enhance their patient management strategies, helping physicians interpret new clinically relevant findings, analyze health policy, and having access to resources for review. I'd like to thank you, our viewers, for electing to take this opportunity for additional learning. We would also like to thank our team for making this possible. We ask that you would fill out the brief survey at the end of this opportunity so that we can know how to best serve you in the future. A special thanks to the Health Council of Southeast Florida for making this project possible. If you would like to know more information about T. Leroy Jefferson Medical Society, please visit us at our website, which is tljmedicalsociety.org. Again, tljmedicalsociety.org.
Thank you, Senator Powell, for being here with us today to talk about this really important topic. So, what are some of the tools that the state of Florida is using to fight the opioid epidemic?
That's a really good question. Thank you for asking. Well, the state of Florida has the Office of Substance Abuse and Mental Health. It's housed within the Florida Department of Children and Families. It's the single agency that's responsible for the statewide system of care, which deals with prevention, treatment, recovery support services, and that's for individuals who are at risk of having substance abuse disorders. In the state, in 2016, the Department of Children and Families was awarded a 5-year, $1.2 million grant from the Substance Abuse and Mental Health Services Administration. Now, these grant funds, of course, were designed to reduce prescription drug misuse amongst Floridians ages 12 to 25 and increase awareness of overdoses related to opioids. Also in 2017, the department was awarded a state opioid targeted response grant, which was funded at the tune of $27 million per group for up to 2 years. That was designed to address the opioid crisis by providing evidence-based prevention, medication-assisted treatment, and recovery services for those individuals. Now, in 2018, the department was awarded a state opioid response grant, and what that did is it funded $50 per year for up to 2 years with an additional $26 million in 2019. And I believe it's $50 million per year with an additional $26 million in 2019. Of course, these federal grants funds were deferred prevention aspects that were done to decrease the impacts of opioids and opioid overdoses for those of us here in the state of Florida, especially for Palm Beach County.
So, Senator, what are the future plans, if any, that are on the table to continue to fight the opioid epidemic in Florida?
Well, keeping in mind that this is a very broad topic, this is something that has affected us and continues to affect us. Now, being that we've gone into another section where we're in a pandemic now, we still have to come out, and there's a number of things that people will be dealing with. So, this past February, the Florida Department of Health announced an allocation of $6.6 million from the Overdose Data Action Grant to 14 counties to assist local communities in the fight against drug overdose and opioid abuse. So what we expect is that the department's receipt of these $58.8 million in that OD2A grant that was first announced in October of 2019 by First Lady Casey DeSantis was a part of her Hope for Healing Florida initiative. Since she's come in as the First Lady, she's worked with our Lieutenant Governor, Jeanette Nunez, who's a former member of the Florida House, who's chaired several committees, including working in committees that dealt with healthcare. They're working together to make this a priority. So I expect that while Governor DeSantis is continuing to be in office, while his wife is the First Lady, this is something that's near and dear to her heart. And the Lieutenant Governor, they have taken this as an initiative that they'll keep working on. What does that mean? That means that those of us who are in the legislature will be making sure that the grant funding that has been specifically allocated towards making this a priority is easier to access, easier to use, and making sure that there's data there to follow up and make sure that what's happening is recorded and moving in the right direction. So I think that's where we're going in the future. As long as we're in the state of Florida, we're seeing a number of opioid deaths or overdoses. We'll continue to see action geared toward reducing that number here in the state of Florida and in Palm Beach County.
And let's talk a little bit more about data. Has there been data collected to suggest that newly legislated policies is working?
Well, I'll tell you this. The Florida Department of Health has a website, and they have a dashboard on their website that includes several detailed quarterly reports regarding the amount of individuals who are experiencing non-fatal opioid overdoses. Now, this data includes age, sex, as well as county data and ethnic information. And it also shows that Florida experienced 3,340 and then 9,272 non-fatal opioid and all drug overdoses, respectively. Now, what happens is this number has slightly increased from quarter one in 2018. Now, this report shows you that non-fatal involved drug overdoses were at 2,604, and then all drug overdoses in 2018 were at 8,015. So if you look at the data and the information that's provided, you can be able to look back and see if we're making progress or not making progress with relation to what's happening and the amount of money that's being spent.
Do you think we're making progress?
That's a good question. And what I'll tell you is we took a snapshot of 1 year to the next year, the last 2 quarters that we had available. What I would ask is that we take a look at the information holistically. Starting in quarter 4 of 2016, it shows that a significant downward trend has happened from quarter 4 in 2016 to quarter 4 in 2018. What we observed was that the overdose rate for that, for all drugs actually, was decreased. Now the non-fatal opioid overdoses declined by 5.17%. And then from 2017 quarter 4 to 2018 quarter 4, it was about 16 people per 100,000. So looking at this data holistically, you've seen a decline, but we're still monitoring that data. We still have a lot of work to do. We still have more funding to do, and we still have to put more professionals in place to make sure that we're moving in the right direction.
So, Senator, in terms of communities of color, what are the policies that have been made in the past that have affected the social and economic well-being of those communities?
When you talk about communities of color and we think about the stigmatism that goes along with mental health or substance abuse, myself, my staff, my team, we're continuing to work with other members of Palm Beach County, including State Representative David Silvers, to work and deal with mental health specifically. So what we've done is, and not only mental health, but criminal justice policy as well. And another major policy that we've changed has been that 10-20 life minimum mandatory sentencing guideline. What we've seen recently in the legislature is a lot of work dealing with criminal justice reform, and it still has to continue to happen so that communities of color are not affected or disproportionately impacted. What we've also seen is that if someone has displayed a gun and they got a 20-year sentence, or if someone fired a gun, including cases where the weapon was fired as a warning shot, they ended up with 20 years or they ended up with life. We have since revamped that to look at holistically or look at the entire picture to make sure that we are not throwing people away here in the state of Florida. When we talk about criminal justice reform, when we talk about mental health, when the police are now looking for someone who has a mental health problem, we put legislation forward to make sure that these people are trained to deal with this so that we don't have issues where people who have a mental health issue are now victims of excessive use of force. So we're putting a lot of things forward in the legislature to continue to battle mental health problems, criminal justice reform. We even kind of consider, I call it in planning, we call it environmental justice issues, and what that deals with is a lot of the low income or communities of color or minority communities end up with what we'll call bad actors in their communities. Factories that produce a lot of gas or produce a lot of negative externalities to the environment that ultimately end up affecting the people who live in those communities. So as a planner, as a state senator, I'm continuing to work with my colleagues in the legislature to work and make sure that we don't continue to see those trends here in the state of Florida. But this is a part where everyone can be involved, right? We don't go everywhere. We can't see everything as an elected official. So when people notice something and they know that's not right, then those people are also challenged to have to speak up. Show up at a city commission meeting, show up at a city council meeting. When you know someone's being treated unfairly because they have a mental health problem, say something. Show up for those people because everyone needs an advocate.
Senator Powell, for the medical professionals that are joining us today, what advice would you have for them?
For the medical professionals who are joining us, I would simply say that you've got an expertise. You've gone to school a long time. You've worked in this field a long time. You know what you're doing. You know what you're talking about. And I would challenge you to get with those of us who are legislators, stakeholders, and people who can influence decisions to communicate what we do not know. I will tell you as a legislator, I'm an urban planner. My field of study is planning. There's a lot of legislators who are attorneys. We've got a couple who are teachers and very, very few who are doctors. And every doctor is not created equal, meaning that every doctor doesn't practice in the same area, just like every lawyer doesn't practice the same thing. I would say the information that you have is very, very important. Share that information. Talk to us, communicate. And if you can't get through to one person, go to the next, because we need you to be successful in what we do. And that's the way that we can change the world and change the state of Florida. I'll end with this. A small group of people can change the world. As a matter of fact, it's the only thing that ever has. And that's a quote by Margaret Mead. So if you feel like you're one person and you won't have impact, think again, move forward, and have the impact that you're supposed to have.
Senator Powell, thank you very much for joining us. We appreciate your wisdom and your knowledge.
Thank you so much for having me. I'm truly humbled to be here.
Hi, I'm Sandy Collier, and joining me is Latasha Clements, retired Deputy Fire Chief for the City of Boynton Beach. Latasha, thank you so much for being here. Tell us a little bit about yourself.
Thank you, Sandy. Thank you for having me. I'm excited to be a part of this 5-part series on opiates. I appreciate being a part of this panel. I am the first black woman. I am the first black deputy fire chief in the Boynton Beach Fire Department. I've served the department for the city for 26 years and the department for 24 years. I'm also the first vice president of the National Coalition of 100 Black Women, where we advocate on behalf of Black women and girls. One of our initiatives is public policy, which is a collaboration of this opiate series, and I am happy and excited to share and be a part of this discussion.
And we are really happy to have you, Latasha. What was some of your experience as a firefighter when dealing with the opioid epidemic in communities of color?
Well, growing up in a low socioeconomic community, I've witnessed many drug users. Some of my family members and friends were drug users. Crack was heavily sold and used in my community. Many people overdosed and died as well. As I began my career in public safety, one of my biggest fears and concerns was responding on a family or a friend that either overdosed or died from drug use, specifically heroin, crack, and any opiate that was sold in the community. In the past several years, we responded to approximately 40 to 60 calls per day, and probably spent more than $2,000 on Narcan just to treat and transport our patients to local hospitals. I saw how this affected families, especially children, who were oftentimes left to fend for themselves. In my opinion, this happens because people lose hope. You know, they can't cope with real life situations where there's a loss of a loved one, no money to take care of themselves or their family, or just stress from everyday life.
So, it's so interesting in hearing you talk about, the factors involved in, addiction and drug overdose. Do you believe the conditions in communities of color made opioids more accessible?
I absolutely believe that there are social and economic conditions that have made opiates more accessible or contributed to the communities of color. The opioid epidemic is one of the largest drug epidemics in U.S. history for all racial and ethnic groups. Attention to this epidemic has focused primarily on white suburban communities and rural communities, and less on Black and African American communities, which are similarly experienced dramatic increases in opiate use. The death rate of African American communities are overdose and death were at 40%, while white and rural communities were at 21%.
So tell me, thinking about that, what kind of strategies did you guys use?
So in my experience, the epidemic absolutely changed our overall strategies in supporting Black and brown communities. This resulted in more conversation on mental health in the Black families, which oftentimes led to drug use. I definitely monitored how our communities were treated by first responders, ensuring that the level of care was not diminished due to the sickness from drug use. In our department, we track responses and often the number of times, names, addresses, dates, and times of those number of responses. This will allow first responders to treat and transport to the most appropriate facility, providing the ultimate and best appropriate care.
So Latasha, as a retired firefighter, deputy fire chief, what was your biggest fear in terms of responding to opioid overdose addictions? Tell me what was your fear?
Well, being that I was born and raised in the city of Boynton Beach, as mentioned previous, one of my biggest fears was responding to a family or a friend that I may find that have either died or OD'd from opiate use. I had to channel my emotions and step up to provide and to maintain professionalism, and in order to appropriately treat that family member or friend with the most respect and transport them to the hospital. So those are my biggest fears or concerns, is responding to family or friends that may have overdosed or got sick or died.
Latasha, we have a lot of medical professionals that are listening to us right now. What advice do you have for them as a retired deputy firefighter? What advice do you have for them?
That's a great question. Thank you for asking. Professionals should know people feel welcomed, understood, and comfortable, they're more likely to request for and continue treatment. Additionally, an urgent and important issue is when people of color are treated at medical facilities, it's very imperative that the staff represents that diverse community that they're serving. When Black or African Americans make the difficult decision to enter treatment facilities, often they will not see any staff that looks like them. And sometimes it makes it that much more difficult to relate or respond or even want to stay and be a part of any medical treatment.
Latasha, thank you so much for joining us. You gave us a lot of food for thought. I'm Sandy Collier. We'll see you next time. Thank you so much for joining us. We're here in the city of Riviera Beach at the Riviera Beach Police Department with Chief Nathan Osgood. And Chief, thank you so much for inviting us here at the police department today. Let's talk a little bit about yourself. Let everybody know who you are. You're new to the city of Riviera Beach. Let's talk about that for a minute.
I'm Chief Nate Osgood, and I'm excited to be here in the wonderful city of Riviera Beach. This is my 34th year in law enforcement. I've just been here 4 months. I hit the ground running, starting with a lot of challenges, one being COVID-19, and amongst many other things. And as we take the little challenges that we're taking a look at, the city is a beautiful city. It's a lot of beautiful sights. I call it a hidden jewel. There's so much to see here and experience. We've got some of the most beautiful beaches in all of South Florida. So, what brings me to the city of Riviera Beach? I like the challenge of tackling the crime problem and hooking up with the community policing. I want to engage with the community. I want to tackle the crime problem. That's twofold. You can tackle the crime problem and make the community aspect one.
So, Chief, you've come into the city of Riviera Beach with, oh my God, a lot of issues. COVID-19 is the big one. But we've had underlying problems, and not just in the city of Riviera Beach, but the county on a whole, globally on a whole, the opioid crisis. So what are you doing in Riviera Beach to help combat the opioid epidemic?
That's a good question. First and foremost is education. We have to educate the public, educate the people we come in contact with drug addiction, and teach them there's a better way. And how do you do that? First of all, you introduce them to rehab centers. You introduce them to, if you need help, you can get help. Because they just don't want to go to any rehab center or anywhere, and they just don't believe that's the case. So you got to start with the education of the drug that they're on. Sometimes they will just make an excuse to say it's just a prescription drug. That's just a way to say, give them a reason to use just the prescription drug. So we want to educate them this is more than just a prescription drug.
And Chief, treatment centers are very, very important for people that are struggling with opioids addiction or any sort of addiction. Treatment centers are important. How many treatment centers are there any treatment centers in the city of Riviera Beach?
I know of one called the Beach House on Singing Island. The Beach House phone number is 877-381-2828. That's the number I pull up online. But I also encourage anybody we come in contact with to Google any local rehab center that they can help themselves out, help them get themselves off. I mean, all you got to do is just start talking about getting help. You know, go get detox. First of all, detox. Get yourself out of the environment. You're not going to rest your way out of an opioid problem. We talk about pandemics. Opioid was the first pandemic that we had to deal with right before the COVID-19. Now, we've had many different drugs and crises that we've been dealing with, crack cocaine, but as far as prescription drugs and people dying instantly, the opioid crisis has been taking out a number of people across the country.
What do you think can be done to combat this problem? I refuse to believe that we can't solve this problem. But from a law enforcement perspective, what do you think needs to be done?
Let's start with education across the board. Let's start with the young kids. You know, back in the days, we had the DARE program, which we still have. Let's start with the young kids about getting away from drugs. Now, I know this is old. It's more than just saying no. You're going to have to educate children from drugs, prescription drugs, stay on your parents' medicine cabinets. Then we move up. You can't stop at the level of the young kids. You got to talk to the middle schoolers, the high schoolers, and the young adults. You got to talk to the parents. That's what I mean by education. It's a lot of open conversation to engage with the parents about drugs. We have our police officers, and we have a COP unit, our community-oriented policing department unit. They go out and they engage with the community on a number of different things. And one of them being, we talk about addiction, drug addiction. So that's just another form of educating. Now, we also ask for us to pay close attention to our doctor offices that might be overprescribing. You know, so if you happen to stop a person and you can see that they have this brand, this doctor from this location, that doctor, you know that they're doctor shopping. So you have to, and sometimes the doctors just don't know they're doctor shopping. You know, they have, the people are strategic when they have an addiction. They have a way of beating the system. So they would actually sell the drugs to make more money to buy more drugs. You know, so we have to keep educating and know what to look for. And once we come down with the education, now you're gonna have no choice but to start affecting the rest. But I do not believe, and I say this wholeheartedly, arresting your way out of a drug addiction problem is not the answer. You're gonna have to educate it and wing people, get people off the drugs. Because nobody who's addicted to drugs really want to be addicted to drugs. They started out with a utopia, it was fun, and then they moved forward. Most of them start out with pain medicine. They've had a pain for some reason or another, maybe back pain, and they start with the pain felt good, then they get the euphoria or the rush, and that felt good to them, but you start using any type of opioid medicine or some type of drug, you may develop an addiction. And it's not that easy to stop once you start.
Chief, a lot of people who get arrested with, and they have drugs on them, they're not criminals. They're fighting addiction. What do you think can be done to be able to keep those people out of jail and just deal with the issue that they have, the issue of addiction?
That's a great question. In Palm Beach County, we have a drug court, adult drug court, where a person who's I believe for first time felon offense, they can go to the drug treatment program, to the drug court. It's going to be supervised by a judge, a whole team, and they stay in the program for 1 year. If they complete this program successfully, their sentence will be commuted. They can get rid of the drug offense, not necessarily completely wipe it off, but they're not going to jail. And we have different types of treatment programs like that. And I tell you, Palm Beach County has one of the most successful drug court programs in all of South Florida. And so we got to utilize our drug treatment program, our drug court more often. Maybe we can expand it more than just the first offense. Maybe go to second and third before you go with prison sentence. I'm going to say, if you're an addict, you're an addict. And there's no crime on having an addiction. We have all types of addiction in this country, from alcohol to everything else. So, however, the offense you do afterwards, because you're an addict, causes you to get yourself in a lot of trouble. So we don't want a person who's an addict not getting the proper help or treatment they should get. But we often tell them the first step is you, the person. You have to want to get the help. You have to want to get the help. You cannot drag a person who doesn't want to get help into a treatment program and think magic's going to happen. They got to sit there, hit rock bottom, whatever they go through, and say, you know what, I need to get better. And once they face the demons that they're facing, they take their first initiative, their first step, and to put themselves in the program to help themselves get better. And that's what we got to encourage people to do. Take that first step. Go get help. You got a family who needs you. You know, you have kids, brothers, sisters, people love you. And being a police officer, we're not here to throw anybody away. We're here to help. So whether you believe it or not, we even love you. We want to try to help you get off the street. And I can tell you, I've seen drug treatment programs, drug courts do wonderful things for people. The person just got to take the first step to make sure they go through it. If we arrest somebody, if they're a drug addict, they need to ask the judge, tell them. Don't be embarrassed, tell them you have a problem. Get through that program.
Chief, we have a lot of medical professionals listening to us. What advice do you have for those medical professionals right now?
It's real hard for me to give advice to people who have mastered their craft. But I can add a few suggestions maybe. First of all, thank you for your service. The medical profession, you put yourself in a position to achieve where you are to help people, just like I'm in a position to help people. I appreciate it. Without our medical staff, our medical physicians, we are in a lot of trouble. So I'm going to say, first of all, I know many medical physicians are out there. They do a lot for the community. Stay compassionate. You know, I know you do not talk down to the individual, but make them feel that you understand. Some of the biggest complaints that I hear, and I know you hear a lot of complaints from the police side, that person's a doctor. They don't understand exactly what I'm going through because they already achieved what they have. That's not true. I know you guys understand, but I'm going to ask more to try to be more empathetic with the patient that you see that we may bring in. That's why sometimes it's hard to get people to stay in treatment because they say they just don't want to be there because nobody really cares. And we know that's not true. I know it's not true. And for pill clinics, and I know they're not many of them because I know the state of Florida cracked down on them. Please understand, not every person who say they have a pain, they really have that pain. Monitor on how you prescribe those drugs, those Oxycontin, those oxycodone, please do. It's a situation where we often find drug dealers selling them. They go get them and they sell them. Now we understand a lot of them started out as patients, but now they're out there, they get them and they can make a few bucks on them, they sell them. We arrest a lot of people for selling them.
Chief, thank you very much for taking the time to speak with us, and we also want to thank you personally for your service to this community. I'm Sandy Collier in Riviera Beach, and we'll see you next time.